Hello, my name is Brynn, and this is my final presentation of highlights and key insights from my practicum with the YUUÄĆ First Nations. Hitatsu, British Columbia is located on Vancouver Island's west coast. Currently, there are approximately 700 community members in Hitatsu. The YFN government focuses on the promotion of community programs, workshops, education, health and wellness, as well as enhancing Nuu-chah-nulth and YFN identity. My my role as a practicum student for the YFN government is to create a community map that focuses on health and wellness. My hope is that YFN community members will proactively understand resources before they need them. PHSP values. So number one, collaborative. A collaborative alliance will help to identify and organize priorities, recommend action, and facilitate conversations between YFN workers, community members, policymakers, healthcare workers, to improve and create Indigenous health initiatives. Community-based, the YFN building is a hub for Hitatsu community members. The new building hosts many departments, a gym, daycare, meeting rooms, and a comfortable seating area. This location is perfect as I can meet and network with multiple professionals as well as community members. Respect and genuineness. I believe it is important to respect others' unique experiences, beliefs, and backgrounds. To be respectful throughout this process, I need to be aware of my own cultural identity in order to successfully relate and openly communicate efficiently with the community. And health equity. When considering health inequalities, I need to understand their history and culture, evaluate present concerns, and explore future recommendations. And PHSP skills, critical and creative thinking. I would like the map to represent each individual that contributes to this project. It needs to be a culturally relevant map that people will actually use. Knowledge, translation, and communication strategies. It is important that I translate verbal and collected information correctly. I want to ensure that my community resource map is easy to understand, big and bright with a legend. Community development and capacity building. I am creating the map in hope of improving overall health and increasing connectedness within the community. And cultural safety and competence. Cultural safety means respecting, gaining knowledge, and recognizing the differences in all the individuals who may be affected throughout this process. The desired outcome of cultural safety is to make everyone feel safe and respected, free of discrimination and racism while we work in their community. And PHSP knowledge area focus. So improving health and reducing inequalities. When facilitating conversation, I need to understand the interrelationship between language, culture, literacy, and overall health in Indigenous communities. Community-based approaches to research and knowledge development. When recommending actions, the First Nations Health Authority feels that a traditional wellness framework between Indigenous communities, healers, elders, First Nations Health Council, and First Nations Health Authorities is necessary. When identifying priorities for a project, it needs to be conceptually and culturally specific, as well as being owned and driven by local community stakeholders and community members. Social determinants of health. Sadly, a basic level of care is not met in Hitatsu. On Canadian reservations, food inequalities are a major concern, and housing conditions are often crowded, leading to respiratory issues, obesity, diabetes, infectious diseases, violence, and social problems. And some of my practicum highlights, working alongside my practicum supervisor and NPC dietitian to secure a grant for a walking club. We then purchased Nordic walking poles and met 3 times a week. Other practicum highlights include community dinners, culture nights, elders lunch, and learning to traditionally prepare and smoke fish. Valuable experiences, community engagement. I hope that my project pushes community members to continue to be involved in community health and wellness decisions and projects. Grant funding and grant management. My supervisor went over some tips for grant writing with me. I would like to further develop grant writing and management after graduation, as I can see how important it is. Program planning. My supervisor went over program planning techniques with me, such as budgeting and prioritizing. I am most proud of the way I interacted with the community, as well as getting people involved in something that is ultimately for them. It was encouraging to see people becoming more and more involved as my practicum progressed. And calls to action commitments. As a graduate of the BA in Health and Community Services program and an NTC outreach worker, I recognize and understand the value of traditional Indigenous healing practices. In my work and studies, I will continue to collaborate with elders and healers whenever possible to improve health and wellness outcomes. I will continue to make change within the Canadian healthcare system by promoting education, social support networks, employment, culture, food security, language, and access to healthcare services. And thank you. I would like to thank my supervisor for her continuous support and guidance. I am very grateful to work alongside someone that is incredibly knowledgeable in the health and community service field. I would also like to thank the Hitachi community members, Natalie and Betty, for all of their help, and of course my classmates. Thank you.